안녕하세요, Dr. Heesul Min. Um,
안녕하세요. Здравствуйте.
Thank you very much for joining our program, and I'm sure they are very busy time during this extraordinary period, and I really appreciate your willingness to share your knowledge about current situation with COVID-19 pandemic. I have several questions to ask you, and most of them related to public health situation and also some clinical questions. So I'd like to ask you about current situation with COVID-19 in Korea. So we all know that South Korea is considered to be successful in mitigating pandemic. The country's response to COVID-19 stands out because it flattened the epidemic curve quickly without closing businesses, issuing stay-at-home orders, or implementing many of the stricter measures adopted by other countries, such as Kazakhstan. What is current COVID statistics in Korea, specifically number of infected and died from COVID-19, and how it is compared to Kazakhstan? With 18 million population as of July 22nd, Kazakhstan reported about 75,000 infected with more than 600 death toll. Please.
Yeah, okay. So now cumulative diagnosed patient is around 14,000 patients. Exactly 13,879 people are diagnosed as COVID-19, and unfortunately 297 people died because of coronavirus, COVID-19. So when we compare the number with Kazakhstan, so the cumulative patient number is quite lower than Kazakhstan. The most important thing is the several months ago, South Korea is the second largest, biggest country for the COVID-19 patient, but they can control quickly, and now around less than 50 people are diagnosed as COVID-19 recently for several months.
Okay, so we all know about the success of your program in South Korea, and that success is largely attributed to massive testing, contact tracing, and effective public health measures such as wearing masks and avoiding large gatherings. So I think the government really controls that situation, and everybody knows that wearing masks isn't the tradition among Korean citizens, and not only Korean but also Japanese and many people in Asia wear masks. But still, are there any penalty for not wearing masks in public places in Korea?
Yes. So actually, there is no official penalty, just recommendation. Just government recommend to wear mask in public transportation and in public area, but there is no official penalty or fine, except one city, it's Daegu. Daegu was the real pandemic city when several months no penalty or fine because of for associated with the mask, and so many countries are interested in the point for success of for COVID-19 in South Korea. So everyone has connection 안 좋은 것 같아요. Can you hear me?
Yes, I can.
Yeah. So everyone is focused on the test volume. So at that time, several months ago, the test volume for PCR is quite higher than other country. But more important thing is tracing. So I think I can explain more about it later.
Okay. Yeah, so with contact tracing, we learned that Korean government extensively uses cellular networks, cell phones technologies for contact tracing. And this is absolutely unique program that everybody tried to learn from Korean experience. And can you tell us a little bit more about contract
Yeah.
tracing and specifically about the use of technology and how efficient it is? And are there any privacy concerns among Korean citizens when
Okay.
somebody, the government especially, uses a cell phone network?
Okay. So I see. So uh, I can compare the public coronavirus COVID-19 control with cancer surgery. Yeah, when we do cancer surgery, we cannot remove only tumor itself. We should remove large area, include the tumor, because there can be some microsatellite or micro metastatic lesion. So we call it radical surgery. So in case of uh, when we do the cancer surgery, we have to do the radical surgery, not only tumor resection. So I can compare like this. So contact tracing is one of the most important things. So if one coronavirus COVID-19 patient is diagnosed, he already contacts so many people. So government have to define so where he visit or who he meet or something like this. So they do the extensive test around this patient. So and also government push and government recommend all people who contact with him to keep the self quarantine for 2 weeks. This is the thing, most important thing for success in South Korea. There is also more. I mean, there is not a lot. There is not so much concern about private privacy concerns. So in South Korea, many people understand about the situation, and they almost all people never mind about the privacy concern. And also, government keep hide to the patient name or some age, or so people cannot know the who exactly it is patient is, but all people can know uh, the patient visit some restaurant or some house or some school, so church, so they can know, I can, maybe I have a possibility to contact with a coronavirus patient. So in the case he have the patient have a symptom or I mean the contact person have a symptom, so in the case he can uh, tell to the government or tell to the hospital there is some possibility of COVID-19 to me or something like that.
Mhm. Interesting. So should the patient diagnosed with COVID-19 and that diagnosis was confirmed by the clinician, some of the patients hospitalized. So are they hospitalized to regular hospital or the special infectious disease hospitals in Korea? And what are precautions observed? And also, I remember when I visited many times Korean hospitals, I saw like special rooms with negative air pressure. So are those still effective now in Korean hospitals?
Yes. So in South Korea, government already set up the set up and decide the special infectious hospital every area. For example, Seoul have a several big hospital and they have a negative pressure room. Uh, Already government decide when for example, COVID-19 or MERS or SARS, anything. So in case of some infectious disease develops, they have a plan, already have a plan to which hospital they have to admit or something like that. They already decide everything before the COVID-19 era. So not all hospitals. So there are some big hospitals who have a negative pressure room. So patient firstly going to the negative hospital which has a negative pressure room. But especially in Daegu area, there were a lot of patients, so they cannot all admitted to the negative pressure room. So in that case, Korean government decide one big public hospital for only for the COVID-19 treatment. So they use all room for the COVID-19 treatment.
Mhm. Interesting. So you mentioned the pre-COVID-19 experience.
Mhm.
I remember in 2012, Korea experienced severe MERS epidemic,
Right.
and I was visiting Seoul at that time.
Mhm.
It was amazing how the government responded to that epidemic. So all these free masks and like these sanitizers were everywhere in Korea, in Seoul.
Right. Mhm.
So I remember
Yeah, so I
also,
think, yeah, right.
and as far as I remember, I also saw this drive-through testing at that time. I was really astonished to see how elegant this system it is.
Yeah.
And I understand that this system now became also popular in South Korea. And I remember even the governor of New York, Andrew Cuomo, purchased that system. And I am pleased to see that such drive-through program now present in Almaty, Kazakhstan. So could you tell us a little more about this method for testing, how safe it is, and why Korea puts so much emphasis on this kind of testing, please?
Actually, the sample collection from the patient with COVID-19 is really dangerous one. So, I mean, the doctors or nurses can be infected from the patient, and also the other people, other patient can be infected from the other patients. So it takes a lot of time for cleaning, for hygiene. So it had to more than 30 minutes for one patient. After one patient, we have to clean everything, and then we have to do it again. So we cannot do the test not so much. So Korean people, actually Korean doctors think about the new system for safe system. So he's think about the McDonald's drive-through system or something. So actually, drive-through system is most safe sample collection way to the doctors or to the patient for everyone. So now Korea have more than 70 sites for drive-through in our country, and also walkthrough. We call it walkthrough, used for collection, sample collection center. So only in Seoul there are more than 70 walkthrough center in all Seoul area. So if the people who want to get the test, they can search and they can go to the nearest sample collection center for walkthrough or drive-through. Yeah. So I want to tell about the importance and the risk about the sample collection. Actually, the sample collection inside the building is really dangerous and it's impossible one. In that case, we have to cleaning all area after one patient, after sample collection of one patient. So it's almost impossible. So I can see the several company or several institute in Kazakhstan can do the sample collection inside the building, but it's really dangerous one. So it should be outside. So in Korea, people can get a test for COVID-19, I mean sample collection, only in outside the building, walk through or drive through. That's all.
That's good. So we know that Korea pioneered this kind of process for testing for sort of dangerous infections. So
Right.
speaking of testing, we know that there are two types of testing. One is molecular testing, which is
Right. Yeah.
PCR.
Right.
Another one
Yeah.
is serological testing. So how extensive serological testing in Korea right now, and what kind of tests for antibodies would you recommend to use?
Yeah, so recently Korean government have an interest in antibody testing, but it's slightly different with other country because now there is not so much patient are diagnosed as COVID-19. So Korean government actually not so interested in antibody test now. But anyway, they are Korean company or Korean government also developed and said now they are doing setup for antibody test now, but it's not fixed yet. So they are under investigation and validation. So our company also now we are doing the validation and compare the several serological test kit from the Korea and from other country. But in my opinion, actually the serological test for the COVID-19 is not perfect now. I mean, there we need more the technological improvement. So it's really hard to believe the test result. So I think, especially for the antibody test, uh, maybe it will take a month, or I think anyway we have to compare more. So we don't know yet exactly. But anyway, one of the most important thing is we don't know yet about the meaning of existence of antibody. So that's one of the big problem. So
I see.
clinically, we don't know about the usage of antibody test now.
I see. Dr. Min, speaking of molecular testing, which is PCR,
Yeah.
you may know that recently Kazakhstan experienced a difficult situation, especially in some part of the country, when the patients were
Right.
diagnosed with pneumonia, which is clearly COVID-19 related pneumonia, but PCR test came negative. And there's so many patients, and this really affected statistics. And starting August 1st, the country revising its reporting system,
Right.
and they will include test negative pneumonia into the reporting of overall COVID-19 statistics. So could you explain why so many PCR tests came negative? Why this really happened in Kazakhstan, although patients were clearly COVID-19 patients?
Yeah, for last several weeks, this issue is really, I mean, Kazakhstan have interest. Kazakhstan, even WHO and Korean government, every country have an interest in situation in Kazakhstan because of this problem. So there are a lot of pneumonia patients who show the negative PCR result for COVID-19. So still, there are some mysterious things until now, but I can explain like this. There are two or three things is associated with this result. One of the big problem, I mean, one of the big reason is quality of PCR, I think, in my opinion. So many patients who are diagnosed with PCR negative pneumonia is located in other city in except Almaty, because here in Almaty there are not so much patients who are diagnosed as PCR negative pneumonia. Almost all patients are diagnosed as COVID-19 pneumonia, so we can detect COVID-19. But actually, several cities in several city patients cannot get the exact PCR test. If even there are not a PCR lab in their city, so they have to send a sample to the other city, to Almaty or Nur-Sultan or other cities. So that's the reason it's really hard to believe the quality of PCR. I can explain like this. One of the public institutes do the more than 10,000 tests for COVID-19 PCR, but they detect only 200 patients. It's a 2%, but it's really hard to believe. In case of our laboratory, recently there are a lot of patients now. So for example, drive-through, walk-through, almost more than 30% people are diagnosed as COVID-19. So every day more than 500 people are diagnosed as COVID-19. So we have to think about, firstly, we have to think about the quality of PCR test. Now, now I understand that also Kazakh government have an interest in this problem, so maybe they will uh, fix it. And another one is I also can see the several cases for PCR negative pneumonia. But as you see, as you explained, it really looks like COVID-19 for CT or everything is really looks like COVID-19. But even we do the test, COVID-19 PCR was negative. So it's it was really interesting. I can also see the several patients. But in that case, we also have to do the PCR. That actually, when we do the PCR test, we swap test from the nasopharyngeal through nose and also through mouth. So we can do the test twice with this. But in case of pneumonia, we have to do the COVID-19 PCR test through the sputum. In case of pneumonia, this area, upper respiratory area, can show the negative result. But in the case, we have to check the sputum PCR. So now we are ready, and we will suggest to test together. I mean, for the patient who admitted with pneumonia in Almaty Public Hospital, we'll do the test for the upper respiratory area and also with the sputum together. So maybe we can exactly know about this kind of things within 1 or 2 months.
But why it is could be important if there is a dry cough, there is no sputum. So as you know that
One of the questions.
COVID-19 usually characterized by dry cough, and that's very difficult to
Yeah,
produce
so
sputum.
right. So in the case, we have to do the bronchoalveolar lavage bar. Yeah, so
It's too
washing.
far.
Yeah, well, it's really hard to do. So anyway,
Right.
so I can explain like this. I have experienced one patient um, for 1 month. She showed a negative PCR result for 1 month with pneumonia. But after recovery of pneumonia, after 1 month, and then the PCR test changed to the positive at that time. Anyway, I think this is not is also this kind of pneumonia. This recent almost all pneumonia patient has associated with COVID-19. I'm sure about that, but we don't know exactly why the COVID-19 PCR test was negative at the first time, why it changed to positive later. So we don't know yet exactly, but in my opinion, it's better to do it together with a lower respiratory area together.
Dr. Min, several questions that related to this situation when there are COVID-19 symptoms, but PCR is negative. So if such patient come to your hospital, for instance, or stays at home, so how long that person should be isolated at home or in the hospital, and what are the criteria for releasing from such isolation? So
Okay.
remember, PCR is negative, but there are COVID positive symptoms.
Yeah, so actually same with COVID-19 positive patient, in my opinion, it can be same. So I can explain together about it with the COVID-19 positive patient. So now especially here in Kazakhstan, there are a lot of patients that are diagnosed as COVID-19, so they all cannot admitted to the hospital. So they have to do self-quarantine at home, their own home. So we have to exactly clarify about when they can go back to their work and normal life. So in Korea, 1 month ago, the criteria was changed. Before that, two consecutive PCR negative was a criteria for releasing, but
It's
now
like
it's changed
CDC in the United
for
States. Yeah.
yeah, right, same yeah.
Yes.
But now it's changed for 1 month ago, and almost all countries now are changing because it's really hard to do the all patient with the PCR test. So when we investigated about it, after if we can divide the patient who have a symptom or asymptomatic patient. So in case of asymptomatic patient, the patient don't have a symptom. In that case, after 10 days without PCR test, the self quarantine was finished. Will be finished after 10 days. For asymptomatic patient, if they don't have any symptom, so in the case after 10 days, they can go back their work. But in case of patient who have a symptom like fever or something, so after 2 weeks, if he have no fever and no symptom for 3 days, also he can go back to work after 2 weeks. So now we decide with a symptom. If he don't have any kind of symptom for 3 days after 2 weeks, I mean, so in that case, without PCR test, they can go back to their normal life.
So they can go back and hug their children, right? And parents.
Right. But because in several cases, even I also can see so many people who show positive after 3 weeks, after 1 month. Even in Korea, there was one patient who showed PCR positive result more than 2 months, but he has no symptoms. So in the case, really hard to explain. And when we investigated about it, the PCR test was positive, but the patient is not so infected. I mean, yeah.
So
We
even
decided.
if PCR shows positive after 3 months, that patient, you consider him or her free of coronavirus, right?
Right.
Okay. So most important is the symptoms, is the presence or
Yeah. After
absence of
2 weeks,
presence
there's not there's
symptoms.
no symptom. Yeah. So in the case, we can
So
decide.
Dr. Min, you mentioned that two consecutive PCR tests are complicated, and of course, for many people, it's because of PCR tests are expensive for many people.
Right.
So, how much regular Korean citizen pays for PCR testing in Seoul, for instance?
Yeah. So the patients are recommended to do the test from the government. In the case, the free of charge, the government pay for them because government recommend you should do the test. So for example, people who contact with a patient, COVID-19 confirmed patients, so they can do the test free of charge. Family or the whole companion of the working space, and also people from abroad, they all should get the test in the airport uh, for PCR test for COVID-19. So this kind of people is all can do the test with a free of charge because government recommend you should do the test. In the case, the patient do not need to pay, but patient by himself want to do the test. So cost is in tenge. It's really quite there are ranges from the cheapest one is 30,000 tenge to the 50,000 tenge between.
If somebody wants to intentionally perform
Right.
the test. Okay, interesting. Also, we just getting many reports indicating that after recovery, from COVID, immune protection lasts only for 3 months, and this is because scientists determined that this is a period, 3 months, when they can actually see the antibodies in the blood. So does this mean that those who survived COVID are still at risk of reinfection? And how does it affect the perspective of vaccine development?
Yeah, right. So this is the really uncomfortable fact for me. And everyone think if somebody got infected from the COVID-19, okay, I already infected and I will be fine from now on. So they can just wear a mask. And but I can see many patients who already I can see many patients infected twice, even within 3 months.
Mhm.
Yes, I can see already several patients who are diagnosed, firstly diagnosed as a COVID-19 with the PCR test for several times. So so there is no doubt about COVID-19 infection. So, and the patient fully recovered from the COVID-19. The two consecutive negative and all symptoms are all away. And after 1 month and after treatment, after recovery from the COVID-19, after 2 weeks, 3 weeks, or 1 month, he got infected again and PCR test show positive again within 3 months. And even in some cases, the symptom is more severe than the previous one.
Hmm.
So it's really now uh, curious, and there are a lot of debate about this kind of patients. But I think when we now the quality is not so high, and still we should investigate about the antibody test. Anyway, as you know, so many patients who infected with the COVID-19, they didn't show the antibody. So in the case, they can get infected again. And as you mentioned, this kind of the protective antibody about the COVID-19 can be disappeared after 3 to 6 months. So I think in the case, they can infect it again, like influenza or other things. So for associated with the vaccination development protect the COVID-19. So we don't know yet, at least maybe at least two times needed. But in some cases, we have to do the yearly vaccination. We don't know yet. Anyway, one vaccination will not be enough to protect the COVID-19.
Mhm. Thank you. So we now been living for almost 6 months since this pandemic started, both in Korea and in Kazakhstan, and obviously we have enough patients who recovered from disease and long-term consequences we can observe. And of course, the most important one is fibrosis of lung tissue. But we now know that COVID-19 is a vascular disease. It affects endothelium of vascular, including coronary heart vessels, including kidney vessels and brain vessels and everything. So I assume you are, as a cardiologist, may already observe some patients who have long-term consequences that affected the heart, kidney, and other organs. And we also observe some patients who complain to fatigue and many other problems. So do you have any assessment, any insight as how long such long-term consequences of COVID-19 may last, and what kind of rehabilitation you would recommend for those kind of patients?
Yeah, so unfortunately, there are not so much data about it. So now almost all doctors are focused on the treatment of the current COVID-19 infection. So all medical facility also focus on the current COVID-19 infection because there are a lot of COVID-19 infection people until now. So, but now it's time to, as you mentioned, it's time to focus on the consequences or the complication after the COVID-19 infection. So uh, actually, I mean, it's not common. How can I say? It's it's not uncommon and it's not common. Yeah. Anyway, so we have to do more investigation and test. Also, we will do the. So now we have a big database of COVID-19 patients because we operate the drive-through and walk-through patients. So there are some patients have extreme fatigue, or some patients have any kind of symptom, but actually we don't know the ratio or some the actual consequences of complication for heart or kidney. But I can tell you in near future, within 1-2 months, we will do the investigation for how much people have a complication about for heart or kidney or something, because with our database we will do the study for patients who didn't get the I mean the PCR test negative, I mean don't who didn't infected with COVID-19, or who did infected. We will compare the COVID-19 patient or normal population. So I will let you know if I know.
Yes, yes, yeah, of
When
course.
I know
It's
exactly.
a, of course,
After
the
one, 2 months.
situation, it's at a nascent stage of development that we're all collecting more and more data, and I'm sure there will be a lot of more experience
Yeah.
to address with this kind of situation. So, Dr. Min, so
Mm.
since the last MERS epidemic, Korea has launched extensive biotechnology program, resulted in the development of sophisticated biotech companies such as CE. Is this program the result of government investment or subsidies, or is it just private initiatives? And do you think Kazakhstan should invest in biotechnology now and in the near future? And what would be specific areas to invest in that area?
Yeah, so as you know, the several years ago, South Korea uh, have experience with MERS, same coronavirus with the COVID-19. So at that time, Korean government uh, can know how much is important to control this kind of infectious disease, a new infection. So at that time, they invest a lot of things, not only for the money. So they also uh, invest to the biotechnological companies. So actually now in Korea, Korea have a several big company like car or some semiconductor or electronics. Korea are famous for this kind of things, but almost all Korean people think in future we have to focus on the biotechnology. So Korean big company or Korean government have a focus will even they focus on the develop the biotechnological company, or Samsung, or every big company should now focus on the biological biotechnology company. So as we can see, this COVID-19 era is really important that have their own biotechnological company in their country. Not only for the test, it also associated with a pharmaceutical company. Now, one drug like remdesivir is known as quite effective for treatment for COVID-19, but it's really hard to purchase. I mean, there are even the supply is not enough, even in United States. So we
Yeah,
cannot
it's
buy
developed
enough.
by American company Gilead, and of course,
Yeah, right.
its supply is very
Remdesivir.
limited. Yeah.
Yeah. So now in Korea, in several cases, we are starting to use remdesivir recently now. But yeah, we can imagine. So some country I mean, the one company with other country make a success to develop a vaccination. But in the case, they should supply it to their own people, their country's people, firstly. It will take several months, or even it can take 1 year to supply all people who live in their own country. After that, they can uh, sell to other countries. So if we don't have any kind of biotechnology company, we just have to wait and from the other country, or we have to uh, expect from the support from the other country. So anyway, it's a really big problem, and so especially for basic pharmaceutical company and vaccination and basic test reagent, I think it would be better to be developed in Kazakhstan.
Thank you so much. We also believe that the future is in investing in medicine, in healthcare, and the
Yeah, right,
biotechnology. And clearly, this current pandemic became sort of like testimony as how important the health of
right.
population is.
Yeah,
So, Dr. Min, my last traditional question. It's a hypothetical. So, should you have an opportunity to write something on the billboard in downtown Almaty or in downtown Seoul to address current pandemic, what kind of words would you use to write on that billboard?
billboard. I just only, I mean, the most uh, uh, successful weapon, I mean, big weapon for about to COVID-19 is actually this one, mask. Yeah, there are several reasons why Korea is success from the COVID-19 infection until now. I already explained about testing or tracing, but I think one of the most important thing was mask. Almost all Korean people wear a mask now. Even there are only 30 patients are diagnosed in a day in the whole country, but almost all they are wearing mask for other people. So I really want to emphasize about the importance of mask.
So on the billboard, you would write "Wear a mask." Dr.
Right.
Heesuk Min.
Yeah. Right.
Okay, great. Thank you so much, Dr. Min, for a very informative interview. This is the most helpful, and I'm sure many Kazakh citizens would be very interested to listen to your opinion about current pandemic and to learn about Korean experience with mitigating this pandemic and your recommendations for the citizens of Kazakhstan and Almaty in particular as how to deal with this extraordinary situation. All the best to you and your family, and look forward to seeing you in person.
Thank you so much. It was a good time to me.